So hello students, I am Dr. Shreya Poddar. I am your faculty for dermatology and I hope everybody gave the INI-CET dermatology test and I hope everybody did well. So let's discuss today this paper quickly and revise all these topics. So going to the first question, which of the following is incorrect about the condition shown in image? So first of all, you have to notice that they are asking you the incorrect statement, right? So what you see in the picture is presence of, let's define the lesion, let's see what we are getting. So we are getting papules, right? So we are getting papules and we are getting pearly papules. They have a very pearly appearance and they have central umbilication, right? So we are getting papules which are pearly and they have central umbilication. So of course, first statement is correct. We are getting a child probably where he or she has developed pearly white umbilicated papular lesions, right? Koebner phenomenon is seen in these cases, but first we have to understand what we are looking at, right? So what do you think this is? This is molluscum contagiosum. This is a very classic picture of a condition called as molluscum contagiosum. And if you remember, when we were discussing Koebner's phenomenon, I told you there is pseudo Koebner phenomenon and there is true Koebner, right? So true Koebnerization and pseudo Koebnerization. True Koebnerization is because of trauma. So there is a deep dermal trauma and that leads to appearance of lesions which were identical in clinical appearance and histopathologically to the pre-existing lesions on a somewhere else on the body, and this is usually on a normal skin, right? But pseudo Koebnerization is false Koebner because this is not due to trauma. This is actually seen in infections like warts and molluscum contagiosum, wherein the organism gets auto-inoculated and you get a pseudo Koebner phenomenon, right? So this here is wrong. True Koebner is not present, you get a pseudo Koebner. But before that, let us look at the other options if this is the best correct answer, right? Septate tomato appearance on histopathology, this is also correct. If you do a biopsy, if you take a specimen of this papule and if you see it under a microscope, you are going to get a septate tomato appearance. So this third statement is also correct. Inclusion bodies are known as Henderson-Patterson bodies. So this is also again correct. You get intracytoplasmic inclusion bodies in molluscum contagiosum, which are known as Henderson-Patterson bodies, right? So the best correct answer is B. You get a pseudo Koebner phenomenon here. You do not get a true Koebner phenomenon here. So let's quickly revise molluscum contagiosum. Molluscum contagiosum is caused by pox virus, right? A virus of the pox family, and there are 4 types of molluscum contagiosum virus, MCV1 to MCV4, correct? What do you get? You get pearly white umbilicated papules. These lesions are usually asymptomatic, right? They are asymptomatic and the most common site is face. You get it very commonly on the face as you're seeing in this patient, right? Which is the most common population that is affected. It is again what you're seeing in the picture, it's a child. So you get pearly white umbilicated papular lesions on the face in a child. The diagnosis is very, very classic and it's molluscum contagiosum, right? So you get it in the child. This is the most common population that is affected. Of course, you can also get it in an adult. It's a contagious condition. Here you get pseudo Koebner phenomenon, okay? Here you get pseudo Koebner's phenomenon and you can also get a positive family history because of course it's a contagious condition. So family history in siblings or caretaker can be present, right? Okay. Now what you're seeing here is a string of lesions, pearly umbilicated papular lesions in a linear fashion. So this is due to auto-inoculation of the organism. the